will walk you through the fundamentals of your current health plans while also exploring opportunities to enhance your benefit strategy. Whether you're looking to better understand your existing plan, considering offering a new plan, or exploring options such as adding a health reimbursement account or other ancillary benefits to improve the employee experience and better manage your benefit dollars, you've come to the right place. Our goal is to equip you with the knowledge and tools needed to make informed, strategic decisions that support both your employees and your organization. Today's session on Consortium Health Plans will be presented by Kylie Rodriguez, our benefits manager. Kylie brings more than 20 years of health insurance experience and is a certified group benefits associate. She serves as a trusted resource for all our municipal members, providing education, facilitating discussions, and assisting in the resolution of claims issues. Before we begin, a few housekeeping items. We will manage questions today in one of two ways. You may take yourself off mute and pose your question directly, or you may enter your questions over in the chat box. Due to the size of this group, we won't be able to look for raised hands. So please use one of those two sources. We are also recording today's session, and we will send the recording along with the slide deck to everyone who had registered in the next few days. And with that, Kylie, I turn it over to you.
Thank you, Elin. All right, I'm just going to get my screen up here.
Oh, here we go.
Can everyone see the presentation, or are you seeing my backdrop screen? Good. Okay, just making sure. I always like to get rid of my little window too before I present. So as Elin was saying, I'm Kylie Rodriguez. I'm the benefits manager here at the Consortium. We want you to think of the Consortium as a resource to ask health insurance questions, look at different options. We try to assist you in any way possible. We're also available to your employees, your members. They can reach out to us directly as well if they're having issues. We always encourage reaching out to Excellus first, but if they feel like they're hitting roadblocks, we're here to smooth the road and make sure that they're getting the support they need as well. So one of the quick things I want to do just to get to know the audience that I'm seeing, I'm recognizing a lot of your names, but I do want to see what your current coverage is. So I do have a quick poll just to make sure everyone's awake. So I'll run that real quick here. And then you can just literally click in, just getting to know what plans you're familiar with, and maybe ones that we're going to learn about today that you're not familiar with because you're not currently offering them. So just give a minute here. Okay, it looks like the percentages have kind of stabilized. So we have like 76% of you are offering platinum right now, 12% are offering gold, 16% are offering silver, and 24% are offering bronze. So a really good mixture, which means I'll be talking about all of the plans. And as Elin mentioned, run a pretty informal presentation. You're not interrupting if you unmute and have a question. It's health insurance. Everyone has questions. And it's easier to ask them when we're on that slide versus waiting till the end and maybe you forget what plan you had questions on. So please feel free to unmute if you have questions, or you're welcome to type them in the chat. Elin promised me she would read me any questions that come in. So if you've ever sat through one of my benefit presentations, this may look slightly familiar. I always like to make sure that the audience is on the same page. when it comes to terminology, because these are terms I'm going to use throughout the presentation, and I want to make sure we're not mixing them up. So a premium is a monthly amount that you pay just to have the health insurance. Normally, an employee would see that premium coming out of their paycheck. You also see that premium as an administrator. The consortium is billing you a premium monthly to offer that health insurance to the enrollees that you have. A deductible is a set amount that must be paid before the insurance coverage begins. So for example, on our gold plan, we have a $2,000 deductible, has to be met first, then the insurance kicks in to pay for those claims at an 80% cost share. Copay is a set dollar amount you pay for service. So on the platinum plan, we have a set copay for certain services, like a $15 copay to see your primary care doctor, versus a coinsurance. So coinsurance means the insurance pays a percentage and then the subscriber pays a percentage. So for example, on the gold plan, it's an 80-20. Insurance pays 80% and then the subscriber pays 20% for that service up until the maximum out of pocket. So today we're going to talk about 3 different types of plans. They're all called metal level plans, and then they kind of break down from there. So our platinum plan is our copay plan. So it has set dollar amounts for services versus our high deductible health plans. Our gold, our silver, our bronze are considered high deductible health plans where you have to meet that deductible first. And then you have a co-insurance that you would pay until you reach your maximum out of pocket versus a hybrid plan. Now, hybrid plans are new to us. They were just approved by Department of Financial Service. We built 2 hybrid plans, a gold and a silver, and we're going to talk about those benefits today as well, just so you can see the full menu options that the consortium has available. Hybrid combines copay and high deductible together. So you may pay a copay for certain services, but you may have to meet your deductible for other more expensive services. So the example I gave here is like the gold hybrid has a $30 copay to go to an in-network primary care doctor, where you don't have to meet the deductible for that visit. It's just your copay. But if you go to an inpatient hospital stay, you need to meet your deductible first, and then it's covered at 80%. So we're going to go over those different benefits and how these plans work differently and how they compare to what you have now. So the question that I've been getting lately is, what am I losing and what am I gaining if I stay with platinum or if I offer a high deductible plan, or vice versa? If I want to move from a high deductible health plan because I'm tired of managing an HRA, what does platinum gain? So I kind of created this quick reference chart to look at the pluses and the minuses, right? So the platinum plan is lower municipal claim risk, whereas a high deductible health plan, if you're funding with an HRA or HSA, HSA is a health savings account, HRA is a health reimbursement account. They do work differently. If you want to learn more about them, this is my shameless plug, come to our next education session in March, where we talk about the differences between an HRA, an HSA, and even an FSA. I know, too many acronyms in this world. But if you're funding a high deductible health plan with an HRA, you're taking on that risk as a municipality because you're having to fund those claims, that deductible claims. Once the deductible met, the insurance kicks in. Whereas a platinum plan, you know, the members paying their copays and the insurance is paying a bulk of that claim, and it's not on the municipality to fund that HRA. An HRA is not needed with a platinum plan. A platinum plan has no in-network deductible, whereas high deductible health plans have a deductible to start out with. The platinum plan does have a higher premium. High deductible health plans have a lower premium. The biggest thing is looking at, is the cost savings worth the extra administration? Because if you're funding an HRA or HSA, you typically have a little bit more municipal administration that needs to be happening on paying, funding, and keeping track of claims. It depends on how you do it. You can also contract out to an agency to manage that for you. But you're working with them to make sure that those issues get resolved as they come up. So I put kind of, again, quick reference. What are the top 6, good bonus pro benefits of each side of the argument? A platinum plan definitely offers that financial protection to members, right? Where the insurance is paying a bulk of those claims, um, you know, and the member is paying their copays. It also encourages use of preventative care and routine care because it's less costly to the end user to go and get some of those appointments taken care of. Whereas on a high deductible health plan, people avoid going to get preventative care because they think they need to pay their deductible up front. There are preventative services where the deductible doesn't apply, and there's preventative services where they do apply depending on the procedure being done. Platinum plan is more marketable for new hires. They always like to see a copay plan versus a high deductible health plan. There's a lot of education that comes with a high deductible health plan if you're funding with an HRA, so they can compare how to use their coverage. One of the biggest things with a high deductible health plan is if you do fund with an HRA, not an HSA, HRA, any unused funds go back to the employer. And typically you roll it over to the next year to be used to help fund the next year's HRA. But it is an added benefit. So if you have healthy people who aren't using it, that money keeps rolling for you rather than being spent out on claims while you're saving on the premiums, the lower premiums for the high deductible health plans. Platinum plan is a lot simpler when it comes to understanding how it works, administering it, and managing it. And then right now, over 80% of our enrollment is in the platinum plan. So it has a stronger risk pool. So that idea, the more people that are in it, those high claims and those no claims balance each other out. So there's less fluctuation. So another shameless plug here. We do a lot of work on our website to offer resources. So please, if you haven't checked out our website yet, it's worth checking out. We actually build, each one of our municipal members has their own landing page on our website that has your benefit summaries, your summary of benefits. You have custom made enrollment forms on our website. Just resources we create and put out there for you. So if you go to our website and you click on the employer tab, you will see the full benefits for all the plans I'm going to talk about today. You'll see all of their benefit summaries, including the hybrids. If you want to dig deeper, if you don't want to go read about it, you're welcome to call us as well. I love talking health insurance. They know it at the office. I'm the health insurance nerd here. So if you want to chat health insurance, I'm always willing to do that as well. But we do post all of this information on our website for you to check out and peruse at your leisure. So I'm going to pause for a minute. Were there any questions up to this point about platinum versus high deductible health plans? We'll get into the nitty-gritty details of each one of these plans and moving forward.
There are currently no questions in the chat box.
Okay. All right, so quick reminder here. So platinum is our copay plan. And then the gold and the silver hybrid actually land premium-wise so the gold hybrid lands between platinum and gold, and the silver hybrid lands between gold and silver. That's also kind of how their benefits land. When you look at copays and deductible rates, which we will in a minute. So that's why they're kind of placed in those areas. So we offer 6 different metal level plans at this point. The gold, silver, and bronze are our high deductible health plans. As you can see, their premium rates are lower, but keep in mind they also have deductibles for in-network benefits. And I mean, I'm not going to read you every single premium rate, but just to compare our platinum plan, these are monthly rates per contract. So platinum individual is at $1,100 to $27.82 versus like a silver hybrid, which is at $879.72. But there's a give and a take with that savings when it comes to the benefit side.
Riley, is it true that one of our strategic plans this year is to look at offering a 3 or 4 tier premium option?
Yes, Elin. I love how you're just spoon feeding me questions. Yes, so we're currently looking into, let me click back here for a second. We're currently looking into, right now we're called what's a 2-tier. So we have single and we have family. If you go and look at open market plans, let's say through Excelis, they offer what's called a 4-tier. So you have single, then you have single and spouse, then you have subscriber and children, and then you have family. So there's actually 4 different rates per plan, and it's divided up depending on how many are enrolled in the coverage, and the type of coverage. So what we're looking at is whether we want to offer a 3-tier or a 4-tier option. The end question is, how much will it cost our members to shift from a 2-tier to a 3 or 4? Because typically, if you're a subscriber and spouse, it's the single rate times 2, right? But and then family rate goes up to cover the reduced rate for those that would have normally qualified for family. Because in 2-tier world, anything above single is family. In 4-tier world, that's not the case. So looking at what those rates would need to be. So a lot of calculations, a lot of math, but we are working on modeling it now that we've gotten feedback from Department of Financial Service on the expectation, if we wanted to do it, how we could administer it. But now we're looking at cost and impact to premium rates if we were to make that shift. So Platinum is the copay plan. There is no in-network deductible. All of our metal level plans have out-of-network benefits as well. As you can see here, they have out-of-network deductibles and out-of-network maximum out-of-pockets. So for example, if you look at our gold plan for in-network, it has a $2,000 individual deductible. That's one bucket. If you then look out of network, it has a separate maximum out of pocket for out of network at 4,000 individual. So if you go out of network, which I look at claims all day long, about 1.7% of our overall claims across the entire consortium are out of network. So not a lot of people go out of network because the benefit really lies in going to in-network providers, in-network pharmacies, in-network hospitals. And we contract with Excelis to manage our medical and prescription claims so we can have access to their national network for all of our members. So really there's not a lot of providers that are out of network in our area. And then anyone who is out of state, those claims get billed back to New York Blue. So a lot of in-network providers, even as you travel or you have retirees that live out of state. But under the gold plan, you'll also see that the deductible for individuals is $2,000, but the maximum out of pocket is $4,000. So what happens between these two is $2,000 would have to be spent in co-insurances and bills to reach maximum out of pocket. Once you reach your maximum out of pocket on any of these plans, you have 100% coverage. So there's a different maximum out of pocket for in and out of network. The goal is not to reach your maximum out of pocket every year. The goal is to have health insurance that suits the needs of your healthcare needs, right? So it's not like I'm going to max it out every year to reach 100%. No, that's the fail safe. That's I've fallen, I've broken a hip, and now I fell again, and I need knee surgery, and I can't afford to pay $10,000 in a year in medical bills. That is your fail safe. The most you'll pay out of pocket is $4,000, and then you'll have 100% coverage for the rest of the year. Where that gets a little tricky is when you look at our bronze plan, and this is how most standard bronze plans are set up, where the deductible matches the maximum out of pocket, But as you can see, the deductible is quite higher than the gold plan at $7,000 for an individual. So when we talk about funding deductibles with an HRA or HSA, this is also what we're talking about funding is the municipality coming up with 2,000 versus 7,000 per individual enrollment, or 14,000 family to fund the deductible. So on the gold, silver, and bronze, you don't really have much coverage besides preventative care until you reach the deductible, which means medications are hitting the deductible, medical visits, PT, emergency room, durable medical equipment, inpatient hospital stays are all hitting that deductible. So the benefit to not having a deductible is you don't have that dollar amount you need to reach before your insurance kicks in, and then you have set copays when you go to the pharmacy, the doctors, or the hospital. Any questions about the difference between a deductible and a maximum out of pocket? Feel free to just holler them in.
Kylie, can you hear me?
Yes.
Why does the gold hybrid versus the gold, and maybe you covered this, the out of network deductibles, why are they higher than the gold when you would think of going from platinum to gold hybrid to gold, that gold hybrid would be less than gold?
Right. So when we built the gold hybrid plan, our goal was to have a lower deductible than our gold plan, offer copays on at least benefits that would be preventative care for anyone with a chronic disease. So being able to go to your specialist, your primary, and get your maintenance medications. In order to do that, because every plan here has to be put into what's called an actuarial value calculator. It's created by the federal government. We don't make this up. We have to plug in all of our benefits into it, and it spits back out a percentage. To be a gold hybrid, it had to fall within gold guidelines, which means it can only go up to like 82% and down to 78% in the benefit range. So in order to fall within that range, we had to adjust out of network benefits. And then we also had to adjust the maximum out of pocket to keep the deductible lower. So it's more attainable for the end user. The other thing is when we built our plans, we're always looking at how we compete in the open market. So we want to make sure that our premiums are lower and our benefits are a little bit better. So when we compared what we built for the gold and the silver hybrid to what Excellus offers, the deductibles are less and the out-of-network maximum out-of-pockets match what Excellus offers, and the maximum out-of-pockets for in-network are less. So these plans are still competitive when it comes to attracting new members to the consortium as well. And they're competitive, you know, if people want to shop outside the consortium, this is the better benefit than what they're going to find out there. So making sure we're factoring all that in. So yes, it looks a little weird having a max amount of pocket that's higher than the gold, but the end goal is not to reach the max amount of pocket. The end goal is to have a plan that works with what the healthcare need is, and making sure that those benefits can be used. So were there other questions about max amount of pocket or deductibles?
Kylie, you're doing such a great job. There are no questions in the chat box currently.
They're just scared, that's all. I know they're out there. They'll just be calling me in about 20 minutes. So I did want to go over the benefits themselves. So for example, if you look at the second row, you know, platinum is a $15 copay to see your primary, gold hybrid is a $30 copay. You don't have to meet that $1,200 deductible. It's just a $30 copay. Because we found with primary care visits, if it's a set dollar copay, you're more likely, one, to set up a primary care doctor, and two, to at least go see them once a year, and making sure you're getting your annual physical and everything like that. A lot of times with our high deductible health plans, we don't see as many picking up a primary care doctor. and getting some of the preventative care that they should. With the gold, silver, bronze, you have to meet that deductible first, and then the gold and the silver have that 20% co-insurance. Same with specialist visits. It's a set copay for the platinum and the gold hybrid. The silver hybrid does have to meet that deductible, but then it's a set $90 copay. But trying to keep some of the copays set so you have access to mental health, diagnostic labs, things like that, that under the gold, silver, and bronze, you have to meet the deductible. So, the full allowable rate is applying to the deductible. And then once you meet the deductible, you have that 20% co-insurance for visits. So as you can see, if you're going to just look at hybrids for a second, the gold hybrid does have a richer benefit in that it has set copays for a lot of services where the deductible is not applying. So it helps keep that out-of-pocket cost lower than if they were on a standard high deductible health plan like silver. Whereas the silver hybrid does mix in the deductible a little bit more, but keep in mind when we had to put it through that actuarial value calculator, it also has to fall within the same benefit range as a standard silver plan. So the deductible needed to apply a little bit more to keep it within that range. And then it's always fun talking about the bronze plan because they're like, well, what's the benefit? I was like, you have to meet that deductible and then it's covered at 100%, but it's a $7,000 deductible. So a lot of times people will look at bronze and be like, oh, everything's covered at 100% after a very high deductible. So just keep that in mind when you're looking at those zeros. It doesn't mean nothing out of pocket for the members. It means they're paying out of pocket until they reach that 7,000 or 14,000 per family. And
Kylie,
then,
an anonymous question has come in.
uh-huh.
It's hard figuring out what's cheaper, a $40 copay on urgent care or a 20% coinsurance. Is there anything out there that helps me figure out how much a visit to my doctor would cost me? Is there any transparency in the cost of medical care or prescription drugs, for example?
Yes, so there's been a lot of new regulations that have come down from the federal government for insurance law saying you have to be transparent about cost of care. So all of our members actually have access to this if they just log into their the Excellus website with their Excellus ID number and create an account. It links them right to their current plan, and they can actually look at their cost share for medications. They can look at their cost share for hospital visits, ER visits, even if they're planning on an upcoming surgery, you kind of plug it in. I'm planning on having knee surgery, and they do an estimate of what your cost would be out of pocket for that, depending on what plan you're currently enrolled in. So it's very useful when I'm a little bit of an over planner, but if you know you're going to have knee replacement surgery next year and your employer offers an FSA, a flex spending account where you fund it with your own money, the employee funds it with their own money, and you go in there and get an estimate and say, okay, knee surgery on the gold plan is going to cost me, $2,800. I'm going to put $2,800 into my flex spending account so I know it's there when I start getting my bills after my knee surgery. So a little bit of planning, if you know things are coming up, it's helpful. But also planning on medications, you go to the doctor and they tell you this is the med you need, and then you're like, you go to the pharmacy and you have sticker shock. You can always go there first and see how much it would cost before you go to the pharmacy, and having those conversations with your doctor about, does it have to be name brand? Does it have to be this medication? Those types of things to help reduce that out-of-pocket cost. We did have to increase copays on certain items on the Platinum plan this year, not because we wanted to, but because when we ran our Platinum plan through the actuarial value calculator, it said we were over our 92% window, which means we had to adjust copays to bring that back down. So for example, the emergency room copay went from 150 to 250. Inpatient hospital went up by $100. That's per stay, not per day copay. So there were slight adjustments this year to our platinum plan as well. We just finished creating a slide deck with our platinum plan benefits because we know that's where bulk of our membership is. And we'll be doing a recording that we'll post on our website that you can email the link out to your employees if they want to review their platinum plan benefits. We're hoping to keep it under 30 minutes and they could just sit there and learn about their plan through a video. So they can always go to our website too, but I know some employees like seeing it rather than reading it. So we also offer a lot of ancillary benefits on our plans that not all health insurance plans would offer, like a routine eye exam. We have an eyewear allowance, hearing aid benefit. Most plans on the open market right now for durable medical equipment, believe it or not, they cover at 50% instead of 80%. So when you see a 20% coinsurance, that means that the insurance is paying 80%. And just like I said, you have to meet your deductible on the gold, silver hybrid, silver, and the bronze plan. You don't on the platinum plan. Whenever I say durable medical equipment, everyone thinks walkers and wheelchairs. You should be thinking CPAP supplies. So a lot of DPW workers, they have to have annual physicals. They may find that they have sleep apnea. They have to use their CPAP. This helps pay for those supplies and equipment that they need. I also think of insulin supplies, testing strips, insulin pumps. Those are the things I think of for durable medical equipment. It's not just about walkers and wheelchairs and hospital beds. It's about functional, durable medical equipment to keep people healthy. The other mandate that came down, I think we're on year 2 of it, is all insulin must be zero copay. That's a New York State health insurance law. So under any of these plans, insulin is always a zero copay. You don't have to meet your deductible on any of these plans to see that zero copay at the pharmacy. So medications are a little bit different too. With the gold, silver, and bronze, you have to meet that high deductible first, and then your copays kick in. On the bronze plan, it's a higher deductible. Once it's met, you have 100% coverage for your medication for the rest of the year. So, and I have this conversation with municipalities that start offering the bronze plan because I always get the phone call. Last year my med was $10 and this year I went to get my med and it's $300. What happened? It's because you haven't met your deductible. So something to keep in mind as a municipality, if you're funding an HRA, you're also funding to pay for medications, which I don't know if you've seen the news lately, but medications are skyrocketing in price, and they continue to climb. So that HRA is then being used up on medications. It may not have to do with medical. It may just be for chronic disease management is their medications are expensive. Versus the gold and the silver hybrid, when they were built, one of the goals was to have access to those medications. So people don't feel like they can't afford them or that they're spending too much money on their medications. So they don't have to meet their deductibles before their copays kick in. And the golden hybrid plans match the platinum plan copays. So if they shifted from a platinum to a silver hybrid plan, the copay would remain the same. All of our consortium drug plans have the exact same drug formulary, which means if I'm on a platinum plan and I have a tier 3 medication, it's still going to be a tier 3 under the gold plan. Or if I'm on the gold hybrid plan and I'm on a tier 1 medication and I go to bronze, that medication is still going to be a tier 1 under bronze. So it makes it easier to administer, but it also makes it a smoother transition if you're shifting from one plan to the other for your employees.
Kelly,
And
is
then-
it true that sometimes a tier 1 or a tier 2 drug can jump to a tier 3, or a tier 3 can drop down to a tier 2 when a new formulary is published at the beginning of the year. So something I was paying maybe less copay, oh my gosh, the next year it's more.
Yes, Elin. So every year well, first of all, our formulary is what's called a frozen formulary. It was a New York State mandate about 3 years ago that you can't fluctuate your formulary more than once a year. And normally it would happen twice a year. And it happened in January and it happened July 1st. Now we only shift our formulary once a year. And by we, I mean Excellus. The consortium does not micromanage their formulary because formulary pricing and adjustments are based on negotiations with drug manufacturers, provider networks like pharmacies, as well as how the drugs are shipped. All of that combines into what the drug cost is. So we rely on Excellus to do that formulary management for us. And then any changes to the formulary are done, they're effective January 1, but members who are affected by the changes are actually mailed letters out in October to let them know, by the way, you're on a medication that's a tier 1 and it's going to a tier 3. Or by the way, you're on a medication that's a tier 1 and it's going to a tier 2. The letters are only mailed to those that have a negative impact or a cost increase. Those that drop in tier are not notified. They just get the nice happy surprise when they go to the pharmacy in January. But there are adjustments made like that because even generic drugs have price changes, drastic price changes, where this generic drug over here was lower. They've now jumped their cost, and there's an effective generic that's lesser cost that could replace that. The effective one stays at a tier 1. The high cost one goes up to a 2 or 3 because it's costing on the claim side more. So kind of making our subscribers responsible consumers of their health insurance, right? Making them aware that as drug costs go up, their out-of-pocket costs go up. So helping us work together as a team to keep those costs low. One of the conversations I have with people who have maintenance meds is they should really look into mail order because they can get a 90-day supply for 2 30-day copays. So they're essentially saving 1 copay every 90 days. On the flip side, because you're part of a consortium and our goal together as a group is to keep claims low so we can keep premiums low. Mail order has less fill fees for us on the claims side, has a higher rebate rate for us on the claims side, which helps keep those drug claims a little bit lower than if we were filling them at retail. All the plans you see here can only do a 30-day fill at a retail pharmacy, which means the consumer every 30 days has to go back to that retail pharmacy for the same med. If their dosage is stable and they haven't changed dosage in years, mail order is a more convenient option where it mails right to their home. And it's a cost savings for them and it's a cost savings for the consortium. So just something to keep in mind. So I made this fun little chart to show where enrollment currently lies across the consortium. This is only for municipalities that are offering meta level plans, and some larger groups may offer more than one meta level plan, so they kind of fill in that extra percentage in certain areas. But right now in the consortium, we only have 2 small group municipalities that don't offer any meta level. And the goal is to shift everyone to meta level because as we increase enrollment in these plans, it helps stabilize that risk pool in each one of the plans. But most of our large group municipalities offer platinum plan except one. So it really is the more attractive plan at the moment, but it does come with that extra cost. I'm going to go back one. Were there questions about the benefits or the plans that we're reviewing? I saw one little chat.
Yes, we have a plan. Is Adderall Ridovan considered a maintenance drug that you can mail order?
Have we considered a maintenance drug you can mail order?
Adderall,
Oh,
Ritalin considered a maintenance drug.
yeah.
Is that
So
specific drug?
yes, so it is considered a maintenance drug. The big thing about mail order, any drug can be shipped through mail order, even the ones that need like cold, like insulin needs to be cold packed. They will cold pack it for you. They normally do a verification call the day before to make sure you'll be home to get it off your porch so it doesn't, get too warm out in the sun. But yes, that would be able to get through mail order. The big thing about mail order you want to remember is you don't want to do it with a medication where the dosage changes a lot. So I'll give you an example of levothyroxine. It's used for thyroid. It's a thyroid medication. And a lot of times you need blood work to see does your level of that medication need to go up or down. But once it stabilizes, that's a great thing to get through mail order. But if you order it through mail order and your dosage is at 75 milligrams, and then your doctor's like, oh, we need to up you to 100, you now have all these pills of a 75 and you need 100. So I normally tell people make sure that the dosage is stabilized, but the Adderall, as long as the dosage is stable, it's a great thing to order through mail order. Were there other questions about mail order?
No, but I'm surprised you're not doing a plug for CanRx right now.
You told me to focus on the plans.
Oh,
Um,
okay.
I will do a shameless plug that we do have 2 mail order pharmacies. So on the back of your card, it'll say Express Scripts. That's one of them. We also you can do mail order through Wegmans Home Delivery. Express Scripts is very tech savvy. You can have a website, you can reorder from the website, you can do an automated call and click all the buttons and order that way. Wegmans is more if you're looking to talk to a human for ordering or reordering. They definitely have a less automated system that way, which is helpful for retirees. Just throwing that out there.
I have another question. When the tiers of a drug change for any drug, especially if it is a maintenance drug, who sends the notification to the subscriber? Does that come directly from Excelis?
So all notifications like that would come from Excelis, yes. And that's why we always encourage our members to open the mail from Excelis. Um, I can't tell you the amount of subscribers I talk to that throw away brand new ID cards or never open their formulary notices or even open the notice that says that their prior authorization's been approved for an upcoming surgery or what have you, because they just don't open the mail from Excelis. I would encourage people to open the mail from Excelis. Were there other questions in the chat?
No other questions at this time.
So since Elin brought it up, I'm going to say it. We do have it's not part of the health insurance, but we do offer a voluntary prescription program called Canna RX. If you're on a name brand drug, you should definitely check to see if they offer it. Canna RX will mail you a 90-day supply of your medication for zero copay right to your door. And how that benefits the overall consortium is the claims through Canna RX are a lot smaller than what we pay for through Excelis. They don't offer every medication. They can't do temperature controlled medications, but they do offer a large list of name brand medications like Eliquis, Ventolin, Symbicort, Glaxambia, Jardiance. Those are all, and the list is a lot longer. We'd be here all day if you wanted me to list them all. But they offer a wide variety of medications that can be shipped right to you. And they changed their enrollment process where you can do it all online and you just click a box to say, reach out to my doctor for the prescription. So they take care of that as well. You don't have to be the go-between for that. So it is a great program. We do have, looking ahead here, we do have an upcoming education session with them on June 25th to learn more about Canna RX with our account rep that we have with them. So shameless plug for all the upcoming education sessions. In March, we're talking about FSAs, HSAs, and HRAs. And if you don't know what they stand for, come to that one. It's a great session with Dan Berkey from Lifetime Benefit Solutions. The consortium has a group rate with Lifetime Benefit Solutions. That only means it's a good deal. It doesn't mean you have to go through Lifetime Benefit Solutions for any of those services. But he's joining us to kind of educate us on those programs and how they work and how they would work with a high deductible health plan to help fund some of that deductible, to make it a little bit more manageable for the employee. And then Elin will be presenting in April, all about plan selection framework, policies and parameters, and the MCA. You'll see me again in May for Medicare 101. And then I already mentioned June, but in July, we'll be doing we're having our account manager from ESI EAP come in. Again, we have a group rate through them, which really works out very well for any small municipalities because there is no minimum rate. You just pay the per employee per year rate for the EAP program if you want to offer it. Again, if you want information on any of this ahead of time, just let me know. And I do know that Elin had some closing remarks as well, so I'm going to stop sharing here. But one last call out, any other questions on the plans?
Hi, Kylie.
Yeah.
So I've been over here, because I'm sure it's the same for many other counties. So the total cost for the Platinum Family Plan is combined between, employer employees is like $35,000. So one of we do offer a HRA. And I know I've been contemplating what you had suggested earlier, going with increasing the HRA that we give to our employees. And so I'm just over here running the numbers, what kind of savings that might be for us. And depending on our plans, because we offer employer coverage, both 80 and 90%, depending on our type of employee. But that could be a county savings to us, little over 17,000 basically between almost 16 and 17.5 thousand per employee that's on our Platinum plan. Am I thinking about that incorrectly? I did the 14,000 for looking at doing a bronze plan with a health reimbursement of 14,000 because that would be for the family, I believe I saw. So
Yeah.
am I putting that together correctly, that it would create that kind of savings?
So you're talking about if you shifted from platinum to bronze and then fully funded the family HRA at 14,000 for in-network.
Right.
Yeah. So it would result in cost savings. I will tell you, we just had a big municipality make this shift. There's some growing pains with it, where you're administering the HRA. I've now encountered providers that are refusing to care for patients on the bronze plan unless they pay for the total visit up front. Which doesn't mean it's the allowable rate that should be charged to the HRA. It means it's the total visit because the bill hasn't gone through insurance yet. So there's definitely some negative experiences with the bronze plan as more and more corporations, that's where they're going to, is high deductible health plans. And the provider end of things are not liking having to deal with an HRA and a bronze. But there are benefits to it too. They have a card they can swipe. You can get them a credit card for the HRA and they can swipe it at the pharmacy and not have to pay out of pocket and then wait for reimbursement. Depends on how you set up the HRA. But there is premium savings there, even with the fully funding. But depends on the user and how well they're managing their healthcare too.
Okay, thank you.
Yeah.
And June, if you'd like to explore options. We can look at your municipality, how many subscribers you have, what kind of plans they're in, and talk about pros and cons of different choices and selections. We're happy to do that for you.
Okay, great.
Did we mention any of the discussions happening in operations?
No, that's April's webinar.
Okay, never
Um,
mind.
but what Judy is referring to, so it doesn't remain a mystery, is all plan selection decisions, especially if all of our large groups were to move from one side of the spectrum to the other side of the spectrum. So either move from a legacy plan or a platinum plan to a bronze plan. That'll really swing the consortium. It will swing the risk pool. It will bring the amount of revenue that we currently are receiving to cover claims. Will bring that down. So we'll have to look at adjustments to premiums. Excuse me.
Nope, you're good.
Look at adjustments to premiums, but we're also looking at in a bronze plan, if you're thinking of saving money on a premium, but funding it with an HRA, that's like double self-funding. You're using us as your reimbursement, your reinsurance carrier at that point, where you're self-funding up to the 14,000. Then we are self-funded as an entity. And that causes an additional burden on the consortium. So we may we currently don't have any, but we may put some restrictions on swinging from one plan to another to make sure we continue to have that rate stability that we know and love within the consortium. But we will talk a lot more about that in April as we explore what's going to keep our consortium stable in the long term.
And to Elyn's point, maybe I didn't emphasize this enough, but we do benefit comparisons and cost comparisons for all of our municipalities. We just need to know what plans you're looking at, and we can help you navigate that. You're definitely not on your own to figure all that out. We do include, if you want to fund an HRA, we have some municipalities that only do a percentage on their HRA, not the full deductible. So all of those things we can help you with here at the consortium.
And one of the decisions we've already made with plan selection is this year we will ask that if you are making a plan change, regardless of what that plan change is, that you notify us by September 1st so we can build that into our budget. This year, we had a deadline of October 15th. Our budget is put together and approved by our board. Last year was September 25th. So by the end of September, that's all that work is done. And then we find out October 15th, there's going to be a huge swing. So this year we're moving that date to September 1st for you to notify us. There's a formal notification process that if you contact us and ask us to do a comparison, we'll kind of walk you through that process. But as we're building the budget, the more conversation we have with you, the better for the consortium in the long run. So we're not surprised during the budget planning process. We know what's happening within the consortium, and we're able to adjust to that before you go in to open enrollment. So keep September 1st on your calendar. And even if you haven't made up your mind, talk to us prior to September 1st and say, my board hasn't met. This is what we're thinking. Get your paperwork in so we can do those scenarios for the budget. It doesn't have to be a secret. And even if you're shopping the market and saying, hey, I may leave the consortium, this is what I'm thinking of, it would break our hearts. We would hope we are meeting your needs, and that would not be a possibility. But it is a reality. And we hope those conversations are open and honest and transparent. This is a collaborative effort. The consortium is for you. This isn't us. We're not an insurance company that's separate from us. So when we talk, we talk about we and us. And so as long as we keep that dialogue open, it remains fair for everybody within the organization. Any other questions? Thank you, Kylie, for being so cooperative. We did not rehearse those questions, but I wanted to keep things spicy and lively as we went through. I also want to thank Kylie. I got in 3,500 steps as part of our wellness program while I was attending this webinar. So if I sounded a little out of breath at one point, I was trying to turn off the walking pad while I was answering questions. So anyway, formal closing. Thank you, Kylie. I want to thank everyone for attending today's session. We hope you found the information valuable and that it provided helpful insight into how your health benefits work together to support your employees and your organization. As was said earlier, our next session will be held on March 26th, and we will focus on understanding health accounts. We encourage you to join us as we take a deeper dive into how these accounts function and how they can be used strategically within your benefit program. If you would like any additional information or have any follow-up questions, Kylie already said it, please don't hesitate to reach out to Kylie or to reach out to me or anyone on the Health Consortium team. We're always happy to help. That's what we're here for. Thank you again for joining us today. You should be receiving a copy of the slide deck and the session recording within the next few days. We look forward to seeing you at our next session.